Some of the recent media reports about this B11529. So this is a variant that has been detected and reported to us from our colleagues in South Africa. There are fewer than 100 full genome sequences that are available. We don't know very much about this yet. What we do know is that this variant has a large number of mutations. And the concern is that when you have so many mutations, it can have an impact on how the virus behaves. So right now, researchers are getting together to understand where these mutations are and what that potentially may mean for our diagnostics, our therapeutics, and our vaccines. It's good that they are being detected. It means that we have a system in place. It will take a few weeks for us to understand what impact this variant has. There's a lot of work that is underway. It's a variant that's under monitoring. The TAG-VE will discuss if it will become a variant of interest or a variant of concern, and if that's the case, then we will give it a Greek name. But it is something to watch. Everybody that's out there needs to understand that the more this virus circulates, the more opportunities the virus has to change, the more mutations we will see. Every single one of you watching has a role to play in driving transmission down, as well as protecting yourself against severe disease and death. So get vaccinated when you can. Make sure you receive the full course of your doses, and make sure you take steps to reduce your exposure and prevent yourself from passing that virus to someone else. So today, WHO's Technical Advisory Group on Virus Evolution met to discuss the variant B11529, to discuss what we understand about this variant and if it should be classified as a variant of interest or a variant of concern. Based upon the information that we have, particularly from South Africa, they have advised WHO that this variant should be classified as a variant of concern. So today, we are announcing B11529 as a variant of concern named Omicron. So Omicron, B11529, is named as a variant of concern because it has some concerning properties. This variant has a large number of mutations, and some of these mutations have some worrying characteristics. Right now, there are many studies that are underway. There's a lot of work that is ongoing in South Africa and in other countries to better characterize the variant itself in terms of transmissibility, in terms of severity, and any impact on our countermeasures like the use of diagnostics, therapeutics, or vaccines. So far, there's little information, but those studies are underway. So we need researchers to have the time to carry those out, and WHO will inform the public and our partners and our member states as soon as we have more information. Once a variant is classified as a variant of concern, it's really important that we have good SARS-CoV-2 surveillance around the world, including better genomic sequencing, because we want to be able to detect this variant where it is circulating. It's also really important that studies are undertaken in the field to look at any clusters, and also the studies that are needed in the lab to look to see if there's any changes in severity, any changes in our impact on diagnostics, therapeutics, or vaccines. The Technical Advisory Group for Virus Evolution will be meeting regularly about Omicron. It will take days to weeks for some of these studies to be undertaken. It's really important that these studies are done, and they're done comprehensively. As soon as we have more information, we will make that information public. But it's important to know that there's a lot that you can do to keep yourself and your loved ones safe. We understand that people are concerned. The good thing is that we have monitoring systems around the world to detect these variants very quickly. This variant was detected a few weeks ago, and already scientists are sharing research with us, information with us, so that we can take action. What's really important as an individual is to lower your exposure. The measures, these proven public health measures, have never been more important. Distancing, wearing of a mask, making sure that it's over your nose and mouth with clean hands, making sure you avoid crowded spaces, be in rooms where there's good ventilation, and when it's your turn, get vaccinated. There are a lot of different scenarios that we're considering for Omicron, and of course it's still very early days. We don't have all the information yet on transmission in terms of if there is a fitness advantage, if it's more transmissible. There is some suggestion of that, but again, it's early days. We expect to have more information on transmission within days, not necessarily weeks, but in days. In terms of the severity profile, we have seen reports of cases with Omicron that go from mild disease all the way to severe disease. There is some indication that some of the patients are presenting with mild disease, but again, it's early days, and we do have a surveillance bias right now in terms of the cases that are being detected. There is also a suggestion of increased hospitalizations across South Africa, but that could be a factor of the sheer fact that we have more cases And if you have more cases, you'll have more hospitalizations. It is certainly possible that one of the scenarios is that the virus, as it continues to evolve, may still have a fitness advantage, meaning that it could become more transmissible than Delta. We'll have to see. But we don't know quite yet about the severity. The more this virus circulates, the more infections there will be. The more infections there will be, the more people will die. And this is something that can be prevented. So everything that we can do for Delta, which is dominant worldwide, needs to be applied and strengthened for Omicron. We have reports of Omicron in 38 countries in all 6 WHO regions, and we do see increasing trends in Omicron in South Africa. So there is a suggestion that there is increased transmissibility. What we need to understand is if it's more or less transmissible compared to Delta. The Delta variant is still dominant worldwide. That's important to keep in mind. So we need to see how Omicron compares with Delta when they're both circulating in the population at the same time. So it'll take a few more days, for us to get that information, and we're grateful for that research that's ongoing. Now, this variant has a number of mutations, a large number of mutations, some of which we know a little bit about because these same mutations have been identified in other variants. And there's other research that has been done, for example, with alpha, with beta, with gamma, with delta. And so we have some clues that we may have some reduced efficacy of vaccines, but we don't have that information yet, and it will take a week or 2 or 3 to get that. And we need science, we need the scientists to have a little bit more time before we have that answer. We just want to assure you that the vaccines that are in use right now have very strong protection against the dominant virus that is circulating globally. So it is absolutely critical that when it's your turn, you get vaccinated, because the chances of you developing severe disease and dying with vaccinated is significantly less than if you're not vaccinated. Vaccines are saving lives, and we need vaccines to get into the arms of all of those who are at risk in every single country, not just in some countries, and not adding more vaccines to people who are already protected, but getting the first and second dose to those individuals who are at risk in all countries. There is still a lot of uncertainty around Omicron, and this data will come in, and there are scientists around the world that are studying this, but there's no indication to suggest that the vaccines won't work. Even if there is a reduction in efficacy, it's still better to have the vaccine because it will save your life.